What is ADHD? The common myths. If you asked someone, what is ADHD? A few decades ago, they'd probably describe a hyperactive little boy, constantly fidgeting, talking out of turn, and struggling to sit still in a classroom. Even today, the most common image is a child with too much energy. But for millions of adults, ADHD doesn't look like that at all. It's an invisible struggle that makes you feel lazy, unmotivated, and like you're constantly fighting against yourself. It's the feeling that you're smart, but you just can't get it together. So, if it's not just for hyper kids, what is it? Today, we're going to clear up the confusion and give you the real, scientifically backed truth about what ADHD is. The core definition: ADHD stands for Attention Deficit Hyperactivity Disorder. But that name is a little misleading, especially the deficit part. It's not that you have a deficit of attention, it's that you have difficulty regulating your attention. Your brain isn't broken, it's just wired differently. ADHD is a neurodevelopmental condition, which just means it's a difference in how your brain develops and functions. It's linked to a difference in key neurotransmitters like dopamine and norepinephrine, which play a huge role in motivation, focus, and reward. The primary difference is in your brain's executive functions. This is your brain's command center, the system responsible for things like planning and prioritizing, starting and completing tasks, managing emotions and impulses, organizing your time and space. The three presentations. ADHD isn't a one-size-fits-all condition. It shows up in three main ways, or presentations. You might recognize yourself in one of these more than the others. 1. Predominantly inattentive presentation. This is the most misunderstood type, especially in adults. You might not be hyperactive at all. Instead, your symptoms are internal. This looks like task paralysis, the inability to start a task, listening, but not hearing, zoning out in the middle of a conversation, time blindness, the inability to feel the passage of time, making you constantly late. 2. Predominantly hyperactive impulsive presentation. This is the one most people think of. For adults, the hyperactivity is often internalized. This looks like internal restlessness, feeling a constant need to move, fidget, or get up. Impulsivity in speech, interrupting people or blurting things out. Emotional dysregulation, experiencing intense mood swings and emotional highs and lows. 3. Combined presentation. This is the most common diagnosis, where a person experiences a combination of both inattentive and hyperactive impulsive symptoms. It's not a flaw, it's a difference. If you're watching this and recognizing yourself for the first time, you might feel a wave of emotions. Maybe relief, maybe sadness for all the times you blamed yourself. For years, you probably heard things like, "You're not working hard enough," or "You just need to try harder." But the truth is, you were trying harder. ADHD is a condition of how you regulate, not a lack of effort. It's not a flaw, a weakness, or a character defect. It's just a difference in how your brain works. The path forward. Understanding what ADHD is the first step. It's the moment you can stop blaming yourself and start finding the right tools that work for your unique brain. Your ADHD brain can be a huge advantage: creative, empathetic, and innovative. The key is to find the strategies that help you manage the parts that are difficult. If you're ready to learn how to manage executive function, overcome task paralysis, handle emotional dysregulation, and build a life that works for you, hit the subscribe button. We're going to build a toolbox of natural tips to help you thrive, not just survive. Thanks for watching, and I'll see you in the next video.